welcome everyone to our expert seminar. Today is May 29th, and we are finishing up our month of Asian American Heritage, celebrating Asian American heritage, as well as learning about mental health. First, let's tell you a little bit about who we are. We are the Free Peoples. We make up a grassroots organization of teachers, students, parents. We seek to actively build political power to BIPOC communities of West Michigan. We also have a connected PAC that actively seeks to support candidates for local, state, and eventually federal offices. Today, we have a great lineup for you. I don't want to take much time. We have three very special guests that will be joining us today. First, let's get our host, Freed People's Own DeLau, to join us on the stage.
Yay, I'm here.
She was having just a bit of trouble before we started, so she's trying to connect. Well, let me tell you a little bit more about the Freed Peoples as DeLau is connecting. So our mission is to educate the community. Hi, DeLau. And part of that is through a free monthly seminar. This is our very first free monthly seminar. So we'll be looking for your feedback, as well as every month we do a monthly teach-in. We do it at the DAAC in Grand Rapids, where we feed you mentally and physically. Come out June 26th is our next teach-in. We will be celebrating Pride and Black music. So I believe DeLau's first speaker.
In hope, it keeps kicking me out.
Okay, you're on.
Okay, all right. Hi, everybody. So we will get started with Wayne Ho. Okay, great. It is working. Thank God I haven't been kicked out. So our first speaker is Wayne Ho. He's the president and CEO of the Chinese American Planning Council. And he is the nation's largest, Chinese American Planning Council, the nation's largest Asian American social services agency. The mission to promote the social and economic empowerment of China.
To reconnect, I just wanted to thank her for the introduction and thank the Freed Peoples for inviting me to come. So as DeLau was saying, I'm Wayne Ho, and I'm the president and CEO of the Chinese American Planning Council. We are the largest Asian American social services nonprofit in the country. I'm joining you all from New York City, specifically Brooklyn in New York City. And the Chinese American Planning Council, we serve 60,000 New Yorkers every year through our programs in the areas of education, family support, and economic and social empowerment. So it's my pleasure to be here with all of you today. Especially as we celebrate Asian American and Pacific Islander Heritage Month. As we near the end of the month, I think it's a good opportunity for us to reflect on how the community is doing, especially in the past year plus of the pandemic. So just a little thing about me. I was born in Singapore, and my family and I immigrated to the United States when I was less than a year old. So it was my mom, my dad, my grandparents, and my brother and I all moved to San Jose, California. And growing up in San Jose at that time, in the mid-'70s, it was not a very diverse area that I was in. I was the one of two kids of color in my kindergarten class. My brother, who's a year older, was one of three kids of color in his class. We did not speak English when we went to elementary school. And I just remember not wearing the best clothes, having bad bowl haircuts. And 4 weeks into my going to kindergarten, I got glasses. So that was basically an invitation for every bully to come out against me and my brother. What I always remember about my public education is that as I started getting older and older, I started getting into the higher level reading classes. I started getting into the higher level academic classes. And in San Jose, there actually is not a unified school district. There's a lot of little school districts for elementary school, for middle school, for high school. And I remember going from 6th grade to 7th grade that they required me to take a test to figure out what my English proficiency was. And I remember taking a test on a weekend and looking around, and everyone in the room with me were all Latino or Asian American. And it didn't really make sense to me because at that time, as I said, I was at a higher academic level. So I was trying to figure out why that was when my grades and my classes reflected my academic success. And then fast forward to 2 years later when I was going into high school, because once again, different school district, they wanted to test us for English proficiency. I remember looking around again, and there were Arab Americans and more Latinx communities, more Black and brown communities, and Asians were in the room taking the test. And at that point, it really made no sense because in junior high, I was in all the honors classes, and why were they testing me? And now that I look back and I started talking to folks when I was in high school about the test, a lot of it has to do with tracking and looking at how is it that Asian Americans and Latinos and others, whether they're going to have academic access or not. So just being in ESL as a kindergartner, as a 5-year-old for a little over a year, that always followed me regardless of my academic abilities. And from that point forward, when I got into UC Berkeley as undergrad, my schools got more and more diverse, but I also want to acknowledge that my public schools were always strong academic institutions. But it wasn't until I got to UC Berkeley, started taking Asian American studies classes and ethnic studies classes and learning more about systemic racism that it really put a language towards a lot of what I experienced as a student, just noticing who has academic opportunity, who does not, how are kids tracked. And from there, it really emboldened me to try and do something and try to change the conditions that students face. So instead of just focusing on the child and thinking that children have deficits, what can we do as adults, as administrators, to recognize that the conditions that folks face might not be equitable and just and accessible to all? So fast forward to now, as the president and CEO of the Chinese American Planning Council, this has been an opportunity for me to run a nonprofit organization to address these issues, to do both, providing services to community members who need some support to thrive in New York City, as well as doing policy and advocacy work and social change work in order to change the conditions that our community members face. And as an Asian American who has always worked in the nonprofit sector from the late 90s to now, I've always seen it as my responsibility to first represent the Asian American community and educate others about the Asian American community. Secondly, is that the Asian American community is very diverse. In New York City, we represent over 40 ethnic groups, speaking over 100 languages and dialects. So it becomes very important for the Asian American community to have solidarity and unity together and really be a pan-Asian community. And then last but not least, my career has been about making sure that we stand in solidarity and work in coalitions with other communities, other BIPOC communities, LGBTQ plus communities, women identifying communities, other immigrant communities. And that's where during AAPI Heritage Month, I think it's important to reflect back on what's happened in the last 15 months. So in New York State, in March is when the state went on pause and all non-essential businesses were closed. But I'd like to remind people that it was really the Asian American community that suffered first. So in January of 2020, the Asian American community was already hearing about what was going on in Asia with the coronavirus. Unfortunately, in January, that was when community members stopped going into Asian neighborhoods and stopped going to Asian businesses. So, for example, in Chinatown, there was already in January 50% of businesses were seeing a 50% drop in revenue. In Flushing, Queens, in Sunset Park, Brooklyn, in Jackson Heights, Queens, and other Asian American neighborhoods, there was everything from 50 to 80% drops in businesses going back to January. So that means 2 months before the state of New York went on pause, the Asian American community was already facing economic hardship. On top of the economic hardship and what we would know would be the public health devastation of COVID-19, that was when we started to hear a lot of anti-Asian bias. I remember in February, I was walking on Canal Street, which is a major thoroughfare for Chinatown here in Manhattan. And some of the street vendors were trying to get tourists to come in and buy stuff. And I overheard the tourists saying, "No, I'm not coming inside. I don't want to catch coronavirus." I had staff members who were in Starbucks and they happened to sneeze. And the patron next to them in Starbucks said, "Oh, you have coronavirus." So we started hearing already microaggressions and jokes and these inappropriate comments going back to January and February of 2020. So when New York State went on pause in March 22nd, 2020, and New Yorkers were told to stay home, my essential workers were still out in the community serving the most vulnerable. So we have about 5,000 staff at CPC who run programs from daycare to senior services to public benefits enrollment, after school programs. And of the 5,000 employees, over 4,000 were still out in the field during the shutdown. And they were out there providing home care to homebound seniors or to the developmentally disabled. Our affordable housing units were still running, and we had to provide our wellness programs to our residents. We were delivering meals through our home delivered meals program to hundreds of seniors a day, because oftentimes that's their one hot meal. We opened up our daycare programs to make sure that children of essential workers were still looked after while their parents were back at work. In addition to us continue to run our essential services, we launched emergency programs. So we started partnering with restaurants, with mutual aid groups in order to provide hot meals. And as of now, a year later, we have passed out over 200,000 pounds of freshly prepared meals or produce boxes. We raised private funding, about $1.3 million in private funding that we handed out to over 1,300 families. And while the stimulus packages at the federal level extended a lot of benefits, unfortunately, with immigrant communities, undocumented communities, mixed status families, many were not eligible for these benefits. So we hand out this money. Keep in mind, we also had a president at that time who was implementing a policy called public charge, where it said, even if you are legally here in the United States, if you use housing or health benefits, you could be considered a public charge, meaning it's harder for you to get your citizenship when you apply. So we had a lot of community members, because of public charge, who didn't want to take advantage of the expanded benefits or the stimulus packages. And we also ran our programs virtually. So a lot of our English classes and citizenship programs and college prep programs all went virtual. And we had to support our community members, many of which did not have tablets. They might have smartphones. They don't use Twitter or the web. They rely on an app called WeChat. So we had to pivot really quickly to provide these services. So I want to give props to my team for being so resilient, while at the same time they were risking their health and their family's health in order to serve the most vulnerable during that time. You fast forward to now, about 16 months later, And as we've been reopening our programs for in-person services, so throughout the fall till now, we've been reopening our school-based programs, our after-school programs, our senior services, our community centers have been reopening. And my staff members are now telling me that they're not afraid of catching COVID as much as they are of catching a fist to the face. And I think that's what we have to remind ourselves is, how did we get to this point where nearly 600,000 Americans have died from the coronavirus? The economic devastation that folks have faced is something we probably can't calculate even at this point. That here in New York City, tens of thousands of New Yorkers have died, and we were ground zero for the coronavirus about a year ago. That my staff members are now more afraid of anti-Asian violence. And as the leader of the nonprofit organization, when things closed in March, I asked my leadership team to still come in because we had our lower paid staff out in the field. And that's where I thought we as management had to role model, and we had to demonstrate that we stood behind them, and we were in the office too during that time. So now we're dealing with the rise in anti-Asian violence. And I think we have to be clear that every person, not just Asian Americans, but Black, Brown, Jewish, immigrant, women identifying, LGBTQ, any religious background, they should have safety, dignity, and respect and belonging in the neighborhoods where they live, work, play, study, and worship. Unfortunately, that has not been the case. And during these tough times of anti-Asian violence and harassment, we need to also have tough conversations. And we have to define what community safety means to us. So it's been a time of having really tough conversations with our community members. People must have safety and must have belonging, but we now have a lot of Asian American community members who are saying that we need more police presence in our neighborhoods. And it's a tough conversation because we have to remind them that about a year ago, and remember, we're just a few days past the anniversary of the murder of George Floyd, that we have to remind ourselves that a year ago, we were marching for Black lives, that we were organizing Asian for Black Lives rallies, and that during this time, we acknowledged that the police system, carceral policies, mass incarceration, the prison industrial complex are failed policies, especially for our Black and Brown siblings. At the same time, it's a tough conversation because we have to recognize that for the Asian American community, many of them are living in fear right now. I have seniors who early on who are eligible for the vaccine would not leave their homes to go get vaccinated. We've had seniors who, when they walk the same path every day to just grab groceries or grab some food, the same person who spat at them or got in their face or yelled at them are still there on the same street corner every day, even after our community members might have called and reported the incidents. I have staff members right now, as I mentioned, they're scared of violence, that we've been flexing their hours, letting them come into work a little later, leave a little earlier. We've been organizing carpools. We've been making sure that staff who might live near each other can travel on the subway together. And I think it's important to remind folks that New York City, there's more people who do not have cars than people who do have cars. So everything is always about public transportation. And that's where you have a lot of engagement with strangers. So I think these are tough conversations that we need to have as we're talking about what does safety look like and how during a time of anti-Asian violence, we cannot have the Asian American community continue to be used as a wedge. So that's where we've had to have conversations with our community members about how our relationships with the police is very complicated. That let's all remind ourselves, Angelo Quinto, Christian Hall are two Asian Americans that were killed by the police a couple months ago. That here in New York City, we had the NYPD after 9/11 monitoring mosques and targeting and focusing on Arabs and Muslims and South Asian communities. We have to remember that the police have been targeting massage parlors and Asian American businesses where there's mostly women workers, whether or not they're sex workers or not, that they've been targeted. And about 2 years ago, there was a death of one of these workers when she was trying to escape from the police. We have to remind ourselves that the NYPD has been collaborating with ICE, Immigrant Customs and Enforcement, where just a month ago, a plane load of Southeast Asian refugees were deported from New York. So these are very complicated relationships that we have. And that's why when we remind folks that, yes, you do need to report the incidents you face, many folks don't want to report to the police. And we say that's fine. There's other places to report. There's Stop AAPI Hate, which is collecting a national database. Locally, the Asian American Federation is collecting data, but we need this data to drive better policy changes. The last thing I want to say is that while there's this time of fear and we as Asian Americans have to fight against being a wedge, we need to remind ourselves that there's the stereotypes of the model minority, that all Asians are successful, and we know that's not true. Here in New York, Asian Americans have the highest poverty rate of any racial group. That the other stereotype we have is the perpetual foreigner. I still experience it every day where people ask me, where are you from? Where are you really from? And always thinking that we're not always American, and us being American is conditional. And I think we also seen the objectification of Asian women. And we saw that with the Atlanta shootings a couple months ago, where someone was having a bad day and went to parlors. So during this time, I think it's more important than ever that we have to have unity amongst our communities. And as we end Asian Heritage Month, this is a time that we all need to stand together with our BIPOC communities and other communities together. So thank you very much for this opportunity, and I hope everyone is doing well during this time.
Thank you so much. I had no idea about some of the things that you were saying. Absolutely incredible. Thank you. Thank you so much. Up next, I'm going to bring in Dr. Schwehm.
Hi.
Hello, Dr. Schwehm. Thank you so much again for joining us. The stage is all yours.
Awesome. Thanks so much for having me, and I appreciate y'all taking the time to come today, and I really appreciated hearing some of Wayne's insights about what's going on in the Asian American community in New York. I'm also in New York right now. I'm in Manhattan on the Upper East Side, and I'm a clinical psychologist out here. I did my studies at St. John's University in Queens, New York, and was born and raised in New Orleans, Louisiana, as you can see from, there we go, right over there, my shoulder. So I been living in New York City now for about 8 years on and off. And so I'm going to be here today. I'm going to share my slides here. I'm going to talk a little bit about some barriers to mental health treatment, specifically focusing in on barriers to treatment within minority groups, and talk a little bit about stigma with mental health, and then talk also kind of wrap it up around how mental health is how people's mental health has been impacted by the pandemic. So first off, we want to get a good understanding of what exactly we mean by mental health. So it is anything that involves our emotional, psychological, or social well-being. Basically, we can think of it as anything that's not involving our actual physical health. There's a lot of different things that end up contributing to our mental well-being. Oftentimes people think that, or have this misconception that our mental health, that we have complete control over our mental health. It's something that we do, it's something that we can take care of. And that is partially true, but we actually, from all of our research, we know a little bit more now that there's a lot of other things that go into a person's mental health. And that includes things like your family history, which also has a big play into your genes or your brain chemistry. So having a family member, a mother or father, brother or sister, a grandparent who might have struggled with mental health issues, can play a really big role. Same with your own life experiences. If you had a difficult childhood growing up, it's more likely to put you at risk for having anxiety or depression, or schizophrenia, or any other mental illness. We often think that it's one of those things where, this person's experiencing something, it must be their fault. They put themselves in this position, but the reality is that oftentimes people are not putting themselves in that position. They're kind of born with some sort of a predisposition toward mental illness. Now, it's important for us to take care of our mental health in whatever way that we can, because there's a really big tie between our mental well-being and our physical well-being. We have so many studies now today that show that there's a massive link between how we're doing mentally and how we're doing physically. So it's very important, and we'll talk about some tools that we can use to help us take care of our mental health, things that we can control. But it's important because 1 in 5 people, and that's probably a low number, but approximately 1 in 5 people suffer in their lifetime from a mental health disorder. And minorities are unfortunately more at risk due to a number of different things. And that includes barriers to mental health treatment. There's a number of reasons why people might not seek out treatment. They might not have an understanding of what they're going through. When you think about mental health, and I know those of you who are a little bit older in the chat can kind of recognize that when you were younger, mental health was probably not something that was talked about. When I was younger, mental health was not something that was talked about. It really hasn't come in vogue until the last decade or so, that people are really beginning to actually talk about what their mental health, what's going on with their mental health, that doctors' offices are starting to put in screeners for depression and anxiety, so that whenever you go to a doctor's office, they ask you how you are doing. It's now beginning something that it's becoming more commonplace to use words like anxiety or depression. And so oftentimes we might not even know that our grandparents were depressed, or they were alcoholics, or that they might have had schizophrenia. Whereas we definitely know, I remember growing up having to know my family history, that my grandmother had colon cancer, that my grandfather had heart disease. Those are all things I knew because they were so important to go into a medical visit. And yet, talking about anxiety, talking about depression were not things that were done. And now today we're starting to get a little bit more of that. Another big barrier to seeking out treatment is a lack of access to care. Oftentimes in rural or urban communities, which is where more people of lower socioeconomic status are, and typically people in minority groups, there's going to be less access to care. And it's also in part because people with lower incomes typically have not so great or not at all insurance. And so if you don't have the monetary resources of insurance, you're not going to be able to get the care, because there are so few low cost, low fee, or free service clinics for mental health. And finally, one big thing that comes up in my work with minority groups is that I will oftentimes have people come to me, my patients, and ask, well, my Black patients ask, can I prefer to see a Black provider? Or my Hispanic patients preferring to see somebody who speaks Spanish, speaks in their language, and in every other minority across the board, asking for people of their own background, people who might understand their cultural experiences. And while as psychologists we are trained to be culturally competent, I still won't be able to put myself fully in the shoes of a person who grew up in a Black household, or an Asian household, or an Indian household. And just as Russell's saying in the chat, that it's the biggest challenge that providers don't seem to understand my view of the world. It's oftentimes because we are typically white, typically male, older male, although females are now starting to dominate the field, which is great to get a little bit of diversity in that way, but we are still lacking representation from minority groups. So of course you're sitting here listening to a white provider talk to you about this. It's something that we talk a lot about in our field. How do we get more diversity in applicants? How do we get more people of color to become therapists? Because that lack of understanding of what they're going through, the lack of access to care, lack of access to insurance or monetary resources, all things that minorities are more likely to experience, and therefore lead to higher rates of mental health disease in those populations. And so we want to get more providers who are able to understand their backgrounds, who are able to empathize with their struggle, who have been in their shoes, as opposed to somebody like me who has to try to put themselves in the patient's shoes. Now, one big thing that comes up in our work with minorities is this idea of stigma. And stigma is a big word that is thrown around nowadays, and I want to get a common understanding of what stigma means. So stigma is when somebody views you in a negative way because you have some sort of trait that's thought to be a disadvantage. Now, negative attitudes and inaccurate beliefs about people who have mental health conditions have been incredibly prevalent for a long time. And now, especially with the amount of access that we have to media and seeing what's going on in the world, oftentimes mental illness gets brought up as this, sometimes even an excuse for when we see a mass shooting or when we see something negative in the news. But what actually the research shows is that people with mental illness are actually far less likely than those with mental illness to commit crimes, to do, to murder somebody, to be a part of these shootings. It's oftentimes people who are not mentally ill who do that sort of stuff. And these myths stem from these words like psycho or weirdo, crazy, schizo, basket case, wacko. These are stigmatizing terms that can be associated with people with mental health issues. And these terms often keep people from seeking help for issues like depression. So when you were younger and feeling sad, a friend or family member might have told you that talking about your feelings will make you be soft. That's something that comes up a lot across cultures with my patients, but that's simply not true. And what that does is it ends up forcing people to suffer in silence. So what role does stigma play with our minority groups? So we mentioned the fact that there is, it keeps people from seeking help. And in fact, the studies, our research shows that the proportion of minorities who need mental health treatment and are able to get it in minority groups is half of that of non-minority groups, of white people. And that's simply that's not good. That's unacceptable. And we have to find ways to help our friends, our colleagues, our loved ones, our relatives, to find the help that they need. And in addition, this people not being able to have access to mental health care leads to when they're suffering, that then leads to discrimination in jobs, in education, in housing, and even in medical care. So for many, experiencing that stigma is oftentimes worse than actually living with the condition itself. So the question is, what do we do? What do we need to do to help people to seek mental health treatment? So one of the big things is to help us navigate around this is to think about the way that we talk about it. The language that we use is so important. Wayne was talking earlier about the rise in violence against Asian Americans, and that rise was directly correlated, or part of that rise was directly correlated to former President Trump's the way that he spoke about the virus itself. There was a direct correlation between attacks against that community and the rhetoric that was being used on a national stage. And so that language is really important. And in the same way, on a smaller scale, the language that we use around mental health has to be more kind. We need more we need person-first language examples. So something like a person with schizophrenia. You might have heard me earlier saying very specifically that person has schizophrenia and not that he's a schizophrenic. We don't say something like, my mom is cancerous. We say that my mother has breast cancer. So we say people with mental health conditions, not the mentally ill. We want to use the term of the thing that they're suffering from and not term them as that thing. Because these people walk around us, and even they might be people that you might not know that are suffering. There are very incredibly highly functioning people out there who are depressed, who are anxious, who have schizophrenia, who suffer in silence because they don't think that they can talk to people because of the thoughts that how they're going to be perceived. There are a lot of famous people who suffer from this. There's a lot of athletes more recently who are coming out and talking about their mental health. Naomi Osaka just this week was talking about how she wasn't going to talk to the media because of the way that it impacts her mental health. We've had people like Kevin Love in basketball leading the forefront of talking about it. There are a lot of famous actors out there who suffer from various disorders. Anthony Hopkins comes to mind as one of them. He suffered from a psychotic disorder for his entire life, hearing voices. So when people talk about mental health, be the one who speaks with respect, compassion, and authority, and don't just go along with stigmatizing jokes. Try to start a conversation around this. So one of the big things that's happened over the course of the pandemic is that we have seen a rise in awareness around mental health conditions. Mental health conditions have always existed. And I think that I'll be interested to see what happens here as we start to get some data back from what's happened during the pandemic. But oftentimes we think of it as like, oh, mental health is on the rise. Well, what's really happening is that the people who have been suffering in silence are starting to suffer out loud, and there's becoming more awareness around what's going on. So more than ever, though, we are seeing people seek help. Many ask me how they can help their friends or family members. And I want to talk today a little bit about some of the signs that might help you to point toward, okay, I'm noticing that something might be off with one of my friends or family members. Knowing that these things might not look the same for everybody, here's a few common symptoms that you might see. So things like somebody feeling sad, noticing that they're feeling sad, more tearful, or maybe more withdrawn for longer than 2 weeks. Starting to feel out of control or doing risk-taking behaviors that can cause harm to themselves or others, such as an increase in drinking or driving more quickly, or maybe doing more daring things than they usually do. Not eating or eating too much, so noticing somebody with a significant weight loss or weight gain. Repeated use of drugs or alcohol, drastic changes in mood or behavior, changes in their sleep, extreme difficulty concentrating, and noticing that they're maybe worrying more about little things, are all things that are all signs, both that we can recognize in others and in ourselves, to know that maybe something's not going the way that it normally has, and to maybe check in, both if it's going on with us, to check in with ourselves, or if it's going on with others, to check in with others. So how do we help ourselves? We help ourselves by keeping in touch with our friends and family who can help us to provide emotional support. That's one of the most important things that we can do. We need to make sure that we're constantly doing check-ins with ourselves. Engaging in physical activities can also help. Saying no to new responsibilities when your plate is full. Making sure that you're getting enough sleep. Seeking out help from a professional when you're becoming overwhelmed. But know that it's normal to be going through this. Know that it's normal during a pandemic. Know that it's normal after the death of a loved one, when you're going through a difficult time, a breakup, struggling at work or at school, having money problems. It's normal for us to struggle. It's normal for others to struggle. But when it's starting to last for long periods of time, weeks or months, that's when it's time to maybe do a check-in. So here's some ways that you can check in with other people who might be struggling. I'm worried about you. How are you? And using the word really after that. So how are you really doing? So don't just give me the, oh, I'm fine, but how are you actually doing? I want to check in with you. I've noticed some changes that have been going on recently. Inviting them to open up a dialogue around this, but not forcing them to do that. Letting them know that you're always there for them if they need to talk. It sounds like you're having a tough time. It must be really hard to try to hold everything together when you're feeling this bad. I noticed that you've been feeling bad for a few weeks. Has it been going on for longer? What's been going on? And letting them know that it's not a sign of weakness to speak up. Things that you don't want to say are things like, it's all in your head, or you're just having a bad day. I'm sure there's really nothing to worry about, or man up, you can deal with this on your own. These are all things that we don't want to say because language matters. So to go back to that idea that language really matters. And so what I've put together here are a few resources of different places that are helpful to kind of get a start when you're noticing that yourself or other people are kind of experiencing a little bit of difficulty with their mental health. I put in some things for kind of broader scope for all communities, and I put in a few things for some specific minority groups here. Doing a nice little Google search, we'll find so many community resources in your area. I think what mental health professionals are really good at is, even if we can't help, we're good at finding other people who can help. So if you advocate, sometimes it takes advocating, but if you advocate for yourself and say, I'm really not sure how to navigate this, can you help me? Even if the first person doesn't help, more than likely the next person will. And so I hope that this was a helpful little overview, and I'm happy to answer any questions that anybody might have, and I appreciate y'all having me on today.
Thank you so much. Are there any questions in the chat section? Again, I learned so much from you, Doctor, and from Wayne before you. So much of it resonates with me personally. From my brothers, Black males who are completely stigmatized, and that keeps them out of seeking the help that they need. So thank you for your suggestions, and we will absolutely be sharing this live with our community. Thank you so much.
You're very welcome.
We also have a journalist. Jacqueline is here. I am having trouble. Here we go. All right, let's invite Jacqueline onto the stage. She's a journalist, and she's going to tell us about what it's like being Asian American. There's been a little bit of technical difficulty behind the scenes with our host, Delau, but hopefully, Jacqueline, are you here? You're on mute if you're... Right. Well, we were so looking forward to hearing Jacqueline's experience, especially she's trying to connect now. But I do want to invite you to please come back to our next seminar and our teach-in, and we will have Jacqueline back on the stage. So we are going to cut it short. And also, here is a way that you can donate. Any donations will go completely to funding our monthly teach-ins, where we invite the community in to fill their bellies and their mind with local issues. So any donations will go directly to our monthly teach-ins. All right, with that, we're going to call it a day. Thank you so much to our wonderful, wonderful experts today. I hope that you learned a lot. I know I did, and we'll see you next month. Thank you.